When you cough or feel like you need to clear mucus from your throat, it can have different causes. It may come from the lungs, airways, or throat. We will look at the most common reasons for these sensations and coughing and how to treat each condition. First, let's explain how to guess if it is a lung problem, bronchial issue, or related to the airways. When a person has a cough, especially with mucus, along with a feeling of something in the throat that needs to be cleared and a history of respiratory infection or allergy, it is usually because of the airways or bronchi. Additionally, when the cough worsens in the morning due to mucus building up overnight, it is often airway-related. In cases where a person has the sensation of needing to clear their lungs, there is a 70% probability that it is related to the bronchi. The most common cause is acute bronchitis, which can be caused by viruses or bacteria. This condition typically results in a productive cough with mucus, especially after a common cold or the flu. The person will often recall a recent viral infection, cold or flu. The condition worsens in the morning and can be associated with mild fever and fatigue. Treatment includes rest, intake of fluids, and possibly over-the-counter cough suppressants. If it is a bacterial infection, antibiotics may be required. Medications commonly used during bronchitis cough include guaifenesin, which helps loosen mucus, making it easier to cough up. In Europe, Ambroxol is commonly used. It is also a mucolytic, making it easier to clear mucus. Acetylcysteine breaks down disulfide bonds in the mucus, making it less viscous and easier to expectorate. It also has strong antioxidant properties. Honey is also useful against coughs associated with the common cold. Chronic bronchitis is usually caused by long-term smoking or exposure to irritants over a long period. This condition is referred to as chronic obstructive pulmonary disease, (OPD). During chronic bronchitis, the cough lasts for at least 3 months over 2 consecutive years, and the person typically has a long history of smoking. The cough is very productive with mucus production, especially in the morning. Treatment involves smoking cessation, bronchodilators like salbutamol when needed, corticosteroids, and oxygen therapy in advanced cases. Pulmonary rehabilitation is also important. Chronic bronchitis progresses over time, which is why aggressive treatment is needed to slow down the progression. Another common cause of bronchitis is post-nasal drip. This occurs when mucus from the sinuses drips into the bronchi, often due to allergy or a common cold. The person has a constant sensation of throat clearing and coughing. They also feel that mucus is dripping down the back of their throat, and symptoms are noticeably worse when lying down. Treatment involves antihistamines if the cause is allergic, nasal corticosteroids, saline nasal irrigation, and addressing the underlying cause, allergy or infection. Another cause is allergic rhinitis, where pollen dust or mold causes irritation of the bronchi, leading to mucus production and cough. In allergic rhinitis, the person experiences sneezing, nasal congestion, itchy eyes, and a clear nasal discharge that is usually triggered by pollen, dust, or mold. Treatment involves avoiding allergens, using antihistamines, nasal corticosteroids, and in some cases, allergy shots immunotherapy for long-term relief. Sometimes a cough can be caused by gastroesophageal reflux disease. It tends to worsen when the person is lying down or after eating. The cough is usually non-productive, meaning there is no mucus, and a tickling or irritating sensation in the back of the throat is common. This typically occurs at night or in the early morning. A throat clearing sensation is frequent, along with the feeling of something being stuck in the throat. In some cases, it can be associated with a changed voice called hoarseness. This happens when stomach acid travels back into the esophagus, a condition called reflux, and a small amount of this acid reaches the airways or throat, irritating the airways and triggering the cough reflex. 24-hour pH monitoring is the best way to diagnose gastroesophageal reflux disease when classical symptoms are not present. An interesting fact is that 75% of people with gastroesophageal reflux-related cough have no prominent other reflux symptoms like heartburn or regurgitation, which is why it is called silent GERD or laryngopharyngeal reflux. Treatment involves lifestyle changes, such as elevating the head of the bed, avoiding large meals, and stopping smoking. Proton pump inhibitors like omeprazole are commonly used, as well as H2 blockers. In severe cases, surgery may be required. In 20% of cases, the cough and sensation to clear the lungs can be caused by bronchiolitis, which affects the smaller airways near the lung tissue. This is a more serious condition, and the person may experience wheezing or a whistling sound, especially noticeable during exhalation. This wheezing or whistling, noisy breathing, is a more specific characteristic of bronchial involvement, whereas wheezing during expiration is not common in bronchitis. Also, shortness of breath is an important hallmark of bronchiolitis, whereas it is rare in bronchitis. In bronchiolitis, the person feels chest tightness and a constriction sensation, whereas in bronchitis the more common sensation is mucus in the throat or upper chest, often accompanied by a tickling sensation or the need to clear the throat. In the case of bronchiolitis, the most common cause is asthma, which involves both the bronchi and bronchioles. Bronchioles are irritated by allergens, cold air, or exercise, causing them to constrict, leading to wheezing, chest tightness, and shortness of breath. The hallmark of asthma is recurrent episodes of wheezing, chest tightness, shortness of breath, and dry cough, worsened by triggers like exercise, allergens, and cold air. Treatment for asthma includes bronchodilators inhalers like albuterol, inhaled corticosteroids, leukotriene modifiers like montelukast, and long-term control medications to prevent attacks. Another cause of cough and discomfort from the bronchioles is bronchiolitis, usually due to viral infections. It is more common in young children and leads to dry cough and wheezing. The hallmark of bronchiolitis is wheezing and difficulty breathing, often worsens with exertion. Chronic obstructive pulmonary disease, COP, also involves the bronchioles in its advanced stages. It causes wheezing, shortness of breath, and difficulty breathing. Various pollutants like smoke or irritants can cause reactive airway disease, which is similar to asthma. This reactive airway disease is a more general term than asthma. A person may experience asthma-like symptoms, but they may not be consistent enough for a diagnosis. However, they are noticeable enough to be a concern. This condition often occurs after a common cold, airway infections, or exposure to cold air, exercise, or irritants. Finally, respiratory syncytial virus is a common viral infection in children that affects the bronchioles and causes difficulty breathing and a cough without mucus. When cough and mucus originate from the lungs, deeper structures in the airways, certain key symptoms usually appear. The person may experience shortness of breath during physical activity, general malaise, and weakness. There's a sense of unwellness. The cough can be either with or without mucus, depending on the causative agent. However, in the case of pneumonia, mucus production commonly begins, particularly with yellow or green phlegm, which is less common in bronchiolitis. In comparison to bronchiolitis, difficulty breathing and breathlessness are typically more severe when the lung tissue is involved. Chest discomfort is also more painful in cases of pneumonia and when the lung tissue or alveoli are affected. In contrast, chest discomfort during bronchiolitis is generally much milder. Fever is more common when the lungs are involved, although it is also possible in bronchiolitis. However, when the condition is more irritant-dependent or asthma-like, fever is not a common feature. When the problem is in the lungs, it is most commonly pneumonia, which is a lung inflammation caused by bacteria, viruses, or occasionally fungi. It affects the alveoli, which are the tiny air sacs in the lungs. Pneumonia causes severe breathlessness, a productive cough, and sputum that is yellow or green. The hallmark of pneumonia is a productive cough with colored sputum, fever, and chest pain. Antibiotics are effective in most cases, with azithromycin being a commonly used option. Supportive care with fluids and rest is also important. Sometimes cough can be caused by pulmonary edema, which means fluid accumulation inside the lungs. This usually occurs due to heart failure, and the person experiences severe breathlessness, rapid breathing, and a feeling of drowning, especially when lying down. A rare but possible condition is pulmonary fibrosis, where scar tissue forms in the lungs. It leads to progressive shortness of breath, fatigue, and a dry cough. This condition typically develops after the age of 50, and when no clear cause is identified, is referred to as idiopathic pulmonary fibrosis. Treatment includes antifibrotic agents such as nintedanib or pirfenidone, oxygen therapy, pulmonary rehabilitation, and in advanced cases, a lung transplant. Tuberculosis can also affect the lungs, causing a persistent cough, weight loss, fever, and coughing up blood in more advanced stages. It damages the lung tissue. Tuberculosis is diagnosed using a sputum culture, a chest x-ray, and a tuberculosis skin or blood test. The hallmark of tuberculosis includes a persistent cough, weight loss, fever, and night sweats. Treatment involves long-term antibiotics such as rifampin and isoniazid for at least 6 months, along with isolation during the infectious period.